power. And youth power is all about navigating through the youth's world and trying to address some of the issues that affect young people. Mental health is one of them. And in our previous 2 episodes, we have been discussing mental health. And tonight, we are going to focus on anxiety and schizophrenia. My name is Dorcas Njoki. I have 2 guests here, a pastor and a counseling psychologist. Welcome, guys.
Thank you so much. It's such an honor to be back here again, talking about mental health because it's an issue that affects so many youths, and I'm really glad to be back here.
I am Pastor Joel. I am so grateful to be here. Thank you for such a wonderful time organized by you. We are here, we are ready, and we want to help someone out there.
Thank you. It's such a pleasure having you. So, anxiety. Let's begin anxiety. What is anxiety? How can we define anxiety?
Anxiety can only be defined as that not consistent, but that worry that someone has because of something that is about to happen or something that is coming in the future. Now, it only becomes a problem or a disorder once this person cannot control themselves in that anxious situation.
Pastor Joel, anxiety. What is anxiety?
Yes, anxiety. Anxiety is that state where external factors bring about expectations that are beyond someone's ability to handle, and therefore they bring about a state of instability in mind, in thinking, and also instability in emotions and such things.
Okay, so anxiety affects emotion and mind most majorly, or?
Anxiety affects everyone differently, but it doesn't affect us all in a negative way. Anxiety can also be good. Anxiety can make us aware of situations that are around us. Anxiety can make us now become ready to engage in that obstacle that we have to overcome in the future. So anxiety, technically it isn't bad, but it can be bad if someone doesn't know how to handle themselves when they're anxious.
You see, anxiety is a combination of expectations. So it might be positive or it might be negative. If, for instance, it is positive, there might be some celebration in between. Expectation of celebrations in between. When it is negative, there is no celebration in between. So, depending on the situation at hand, and depending with the individual, because there are some who kuna watu wanafurahianga vitu fulani zenye we labda ziwezi kufurahisha.
Kweli.
Na kuna mtu vitu zingine zinakukasirisha zenye haziwezi kasirisha mwingine. So depending with the person and the situation.
Oh.
Now, anxiety pia, it comes with several factors. Like when someone is anxious, kuna vitu zenye you'll just observe physically in them. There are some people, when they're anxious, this person will be sweating vibaya sana, utapata their armpits. This person watakuwa na an increased heart rate. Roho yake anasikia tu inapiga. It can also raise someone's blood pressure. But that's only the body's way of telling you that, hey, nikamambo, you need to take action, or you need to take charge because there's something that is in the future that we need to handle.
Okay, so you're defining like the signs that
Some of the
can
signs
be used to
that come with-
identify that this person is anxious about something.
Yes.
Oh, what else, Pastor Joel?
Everybody can be anxious, regardless of age and social status. Everybody can be anxious.
How can we tell?
Now, that's when I've said anybody can be anxious. Now, you will know that somebody is anxious. Physical reflections of anxiety in a person, some might be, some of them tend to be sad because they are waiting for some result which will affect them negatively and cause them to maybe shut. And there are some who will be happy. Kuna wengine utaona wanarukaruka, wanatembea, wana smile, all over smile, wamejaa furaha kila mahali, wanaongea na watu wote. Inakuonesha like wakati mtu anaongojea results maybe ya mtihani, you will find that person celebrating all over, celebrating with everybody, laughing with no reason because maybe they are anxious. There are some who even their body appearance huwa ina change. Kuna wengine wanatokea goosebumps sometimes kuna wengine wanalia. Saa ingine kuna wengine wanaweza kuwa anxious hadi mabreak zi loosen up hata kama tu unaona kuna mwingine ndiye anaenda kupanda ndege mara ya kwanza yeah, so unakuta hata break zina loosen, unaona mtu amejiendea haja kidogo so yeah, you can tell, utajua tu huyu mtu ako anxious kwa sababu ya weird expressions ya vile wanaji-express weirdly ama abnormally. But maybe in a good way, majorly in a good way, because they are expecting in something that is in the future, na ama in a bad way because factors zenye zinafanya kwa anxious ni some things that are supposed to happen. Yeah.
Okay, so let's talk about causes of anxiety.
Now, causes can really vary from in between different individuals. But as long as there is something that this person is anticipating for in the future, it can be a cause for them to be anxious. Let's say, for example, you have an exam you intend to do. Obviously, you'll get anxious. You are about to deliver a child. You don't know how life will be hapo mbele. You'd be anxious. So anything that can be an event yenye itafanya mtu akuwe worried can be a cause of anxiety. It really doesn't have to be at one thing. We can't really narrow down to one thing being a cause of anxiety.
Several things.
Yeah, these are social factors. The things that we do, maybe day by day, our normal routine, the things that we normally do. They are not extraordinary things things that are abnormal things. The things, simple things that we do, like maybe applying for a job, going for an interview, expecting results from an exam, such things. They are normal things, but they bring about a certain kind of expectation or anticipation, and when that anticipation is beyond somebody's control, it now becomes that state of anxiety. That person now confirms to be anxious about that situation. It might be normal things. Maybe hata unaweza kuta una expect kukutana na mtu fulani, maybe mjakutana na yeye, ama mtu unataka kukutana na yeye, mmepanga mtakutana mahali fulani, so unaweza kuwa anxious of the appearance of that person.
First
date yeah, it's majorly in affect ladies. Kwa mfano unaweza kuta sasa ndio wako huyo lady ana expect ku first. Siku hizi tuko na hizi za online hizi which I don't recommend. I really don't recommend. So unakuta huyo mtu ndiye anataka kuona huyu mtu for the first time, so unaweza kuta huyo mtu amesweat. It is just a normal meetup, but because kuna some anticipation, unakuta huyu mtu amedevelop anxiety ndani yake.
But there's something that you've said which I disagree kidogo. You've said that women are more prone to anxiety, but for me I tend to think everyone we are all, hakuna mtu mwenye ako immune to anxiety, but it's how you would deal with that anxiety that itafanya this anxiety itakuwa a good thing or a bad thing. It's true, women can women, for men we have testosterone hormone yenye nafanya ina reduce, or men can deal with anxiety, but it doesn't mean that we are not affected by anxiety. We are all the same. All of us, we are affected by anxiety.
Mike, I said majorly women are affected. I didn't say that we men, we don't get affected. I said majorly.
But I think that one can be a stereotype. You're stereotyping us because
No.
to think
He has confirmed.
Women are weak emotionally.
From his statement, he has confirmed that we men have testosterone, which reduce the rate of anxiety in them. What about in ladies?
in ladies, you know what makes us different from ladies?
No, from that point of testosterone.
I'm still there.
Yes.
Ladies have better coping mechanisms as compared to men.
Exactly.
And that is why they can
Now
handle anxiety better than men.
you are defending what
I'm
I'm
not
saying.
defending, I'm only
What I am
stating
saying
facts.
is that because men have this testosterone, they become a little bit stable,
Okay.
and emotionally, men are stable compared to women. That is why it is very easy for a lady to cry hata kwa vitu kidogo kidogo. Unakuta hata vitu zina excite ladies ni vitu
So-
That is
no,
because
let me
we know-
finish, let me
okay,
finish,
let me say your
let me
point.
finish,
That
let
is
me no,
because
let me finish.
we are good at expressing emotions.
So
No,
if
you
that
know
crying
nyinyi
is
wawili
one-
mnanivamia and you are not giving me a chance to complete my statements. That is why hata ukikuta maybe wakati watu wako in that period ya dating, some small things like kubaia lady sweet imetosha huyo mrembo afurahi kabisa milele. But wewe ukinunuliwa hiyo sweet ni just yani what's this?
But there's something you've
But
said.
what I'm trying to say is that emotionally, men are not hit so much by unless it is extreme anxiety, unless it is extreme.
I agree with you, but I also disagree with you. Because for
No,
women,
you have to take a stand.
I'm
You
taking
either
my-
agree or
I'm
disagree
taking my
with
stand.
me.
For women, I'm going to use exactly your words. You've said for a woman she would cry, yeah, when they are facing maybe a difficult situation or they're about to face a difficult situation, and once they cry, hiyo kitu itamtoka kwa roho. Have they not dealt with that situation?
Why turudi hapa mwanzo? Mbona akalia?
Because something imekuwa ikimsumbua.
Yes,
Yeah,
yes,
no.
yes.
On the
yes.
causes, on the causes.
That is why I
right?
am saying that emotionally, wao kuenda chini kwa hiyo kitu, it is very easy for them.
It is.
But for a guy, ina take long. It is prolonged. It is in extreme ndo utakuta ina exhibit these signs and
I
symptoms.
think what
In
he's trying to
extreme.
say, as much as we are easy, carried away by these things,
Yes,
it
you
is-
are. You are.
it is,
You are.
it is, it
No,
is
no, no.
10
You are.
times
You are.
faster again to come out.
But you are easily. That is where I
Now
was.
we are easily pinned down,
Now-
but easily
now, because you are
we stand
easily-
up easily again.
That brings us to this point that ladies are.
They're more prone. Yes.
Yeah.
But
Now you
they-
agree.
they
Now you
easily-
agree with
They
me.
easily cope up compared to men.
Compared to
Yeah,
men.
I don't disagree with that.
Thank you.
But majorly ladies are affected. That was the point that I was trying to bring home. And you
Okay.
have all
Yes.
agreed.
You have agreed.
Now
also.
that we have agreed that anxiety, it's a mental disorder. So how does anxiety affect our day-to-day life?
Anxiety, it doesn't have to affect our day-to-day lives, but it can when it goes to those extreme conditions. For example, if someone they are facing a situation in future, let's say this person is going for an interview in a day or two, and kwa sababu ya hiyo anxiety, huyu msee hakuli halali, then it becomes, we start to question, because it's not normal for someone not to eat and not to sleep. Now that's when we'll start to say that this person is being affected negatively, and now it starts to become a disorder when the reaction that they're exhibiting becomes greater than what is causing them that anxiety.
Yeah. When it is in anxiety is that state where it is prolonged. That kind of if it is fear, it is prolonged fear. If it is panic, it is prolonged panic. If it is what else? If it is worry, it is that prolonged, the extremeness of that emotional state. Now, when it becomes extreme, that is where it exhibits such symptoms. And to some people, utakuta wengine wanakuwa overconfidence because now they are expecting something that is bigger than maybe the people who are around them, and whatever is coming is about to come, it is more visible. It might also be tangible.
Yeah.
You see, there are some who might feel their self-esteem in a reduce. They feel because of anxiety, they tend to hibernate. They don't become they don't embrace confidence in them. So unakuta anaanza kudevelop withdrawal mechanism to some if the outcome is negative. For example, if somebody is ill, I was giving an example. If someone ako kwa ward ameenda kwa surgery, because we do not know, the person does not know the outcome, so self esteem ya yule mtu ina decrease.
Yeah.
So that person will not talk about that situation with confidence. But if a person is expecting to be employed maybe in a large firm, or rather an organization that everybody is wishing to be working there, that person's confidence will rise. Na atakuwa over confidence, atakuwa over joyous, na kuna wengine kunakuwa na sudden sadness in our cover like a cloud.
Yeah.
Yes.
And all that affects how this person works and relates with people surrounding them.
There are some people who are affected, like really much affected by anxiety. For instance, there's someone hawezi akapanda basi, like at all. Basi kwake is a no. Probably it's because of something that they went through previously. So anxiety can also be a result of a traumatic event that someone went through. And it affects this person socially because huyu mtu hawezi akapanda basi. That's just one example. There's some people akiweza kuja kwako, you'll see them ananawa mkono over and over and over again. Not because ati mkono yake ni chafu, but because probably of something they experienced in the past, and they have that anxiety that na nikikaa hivi sinaweza labda nikapata some disease yenye alikuwa amecontract before. Anxiety is something that is that affects so many people without them knowing. That's the sad part, that mtu anaweza kuwa experience anxiety as a disorder without them really knowing that an experience.
It's a disorder.
Yes.
They just think it's normal.
They
that
think
is them.
it's normal.
Yeah, and then to some people, it depends with personality. Let me break it down a little bit. There are some people who they like to be more detailed. They have a touch for detailed perfection. The perfectionists, those kind of people will be they tend to be hit more with anxiety because they tend to dig deeper on the expectation. They tend to find more details on the expectations, and they tend to receive perfect results or perfect outcomes. So because of that, those people, the perfectionists, tend to be hit more with anxiety. But there are some people like the chorelic. They are stable. They are born leaders. They are outgoing. They are courageous people. Anxiety, they may not. They show relative signs of anxiety. And it is hard to tell that this person has been hit by anxiety.
Yeah.
But that does not make it. That does not disqualify them from the people who are affected with anxiety. In fact, they are the people who suffer more.
Probably, I would challenge you. Now, would you tell someone not to have expectations? Kwa sababu wakiwa na expectations, they will be anxious. Nilikuwa nimesema. So should they not have expectations?
No, everybody is allowed to have expectations. And then again, anxiety, it is uncontrollable factor in a person's life. You cannot predict about anxiety. It is unpredictable. In fact, it is uncontrollable. It is a mechanism by which the body reacts and responds to things that are being expected.
So anxiety is
but
a natural reaction.
I want to bring about an example. The 2022 we had a general election in our country, and we have the likes of retired Prime Minister Raila Amolo Odinga. You could see his confidence. While addressing his people. You could see the confidence in him. You could see the
Yeah.
the surety that he's going to win the election.
Mhm.
But I am sure he was anxious about the outcome of the election,
Yeah.
of the elections, even though he could move a mass crowd of people, even though he is a person who has a very great impact when it comes to influence. But in one way or another, as a Korelic, he was also suffering
Affected
to
by
anxiety. But it is hard to tell because he's hibernating within his confidence, he's hibernating within his courage, and he's hibernating within his personality.
But wouldn't you say that that is his way of handling that anxiety? Him using his confidence, him using his position to deal with that anxiety?
No.
Because you've said it was very difficult for you to tell that he was anxious.
You
right?
know,
Okay,
there are some signs that are visible,
Yes.
right?
Mm-hmm.
And there are some signs that are internal.
Mm-hmm.
But all the same, they bring about suffering in one way or another.
Just like we had said that people cope differently,
Yes.
right?
Cope differently.
Okay,
Yeah,
so,
but what I'm trying to say is that when it comes to help, such people, they cannot be helped easily because it is very hard for you to identify. It is very hard for you to know that this person has been hit with anxiety because they tend to believe they can handle everything, just like
Okay,
you were trying to
let's-
say. Just
let's
like you're
take
trying to
this.
say.
Is it because the reason as to why in the Bible we are being told that do not be anxious? God knew.
Mm-hmm.
So we are human beings.
Yes.
So I think God had a reason as to why He told us that we should not be anxious about things, about tomorrow, about what we will eat.
But you know, I'm going to quote that scripture that you've said. God said, okay, it was Paul who wrote. Okay, God said,
It was Jesus.
yes,
It was Jesus who was saying that.
thank you.
Do not be
Do
anxious,
not be anxious
over
about anything.
anything.
But listen to what he said. But in, help
With-
me quote it.
With prayer and
And
supplication.
petition and thanksgiving. He said, do not be anxious, but he gave a way of dealing with this anxiety through prayer.
You see, what I said earlier is that anxiety is the extremeness of this condition,
Mm.
prolonged state of this condition. That is what brings about anxiety. What Jesus was trying to tell the disciples is that you should not allow that situation to be prolonged. That is
Not
why,
to overwhelm you.
yeah,
yes.
to overwhelm you, you have a helper. You
But-
have all. No, wait, let me finish.
Okay,
let me finish.
let's go to the
That is why
types. Let's go to the types now. Types of anxiety disorders.
I wanted to finish
Yeah,
something.
kindly.
I wanted to finish something. That
Yep.
is why in somewhere else you find him telling the disciples, and then speak to the mountains.
Mhm.
All right? Speak to the mountains. If you have faith, speak to the mountains. He was trying to show them that, yes, you can be anxious about anything and everything, but you must develop a mechanism of handling the issues that are approaching.
But there's something you've said that anxiety is only prolonged. Like anxiety is that prolonged
Yeah.
worriness. But do you know that you can only be worried until that event happens, or that thing that is worrying you?
That is
Happens.
prolonged.
So it's not prolonged.
That is prolonged.
It's not.
It takes times. It takes
yes,
times.
it
There's
takes
a
time.
time
Yeah.
between.
But that time is, what's the right word? Like it's not defined. It's only defined by that event.
Mhm.
Like I might be worried about, let's say, about an exam that is about to happen tomorrow. But once that exam is done, will I be still anxious? I won't be. So
Of
it
the
is only
outcome now.
dependent.
You'll be anxious
Now,
of the
now
now
outcome.
there
amount
is
of
what
time
we
that
call
is
time
in
factor.
between.
There is what
Exactly.
we call time factor.
Let's
Yeah.
look at the types.
Yeah.
Types of anxiety disorders.
We have very many types of
We just
anxiety.
look at the common ones.
But we have the general ones. We have 4 major ones. We have generalized anxiety disorder. This is where someone is anxious about things that are general, things that are common. We have panic disorder. That is that like instantaneous anxiety. Yeah? Mtu anakuwa na they can't kuna mwingine atasema they can't breathe or anakuwa na chest pains. That's just maybe another one. Maybe to person to perceive if you have
Yeah, we might have fear. Fear can be
A disorder,
a
yes.
disorder.
Mm.
That is where a person is exposed to maybe some kind of danger.
Mm.
It might be long term
Yeah.
or
Mhm.
short term,
Yeah.
but all the same, it triggers that art of being afraid.
Mm.
You know, you are not you feel like you are in trouble,
Mhm.
and that, or rather, there is a trouble that is approaching, and now you are not able to handle, so it develops to become fear.
Yeah.
So fear is also
Mhm.
another general type.
Yeah.
Yes,
Phobias.
and we
Yeah.
also have social
Social anxiety
anxiety
disorder,
disorder. Yeah.
where that's a situation you're afraid or you become anxious whenever you are before a crowd of people, whenever you are in the midst of people. You
Yeah.
don't want to be in a social setup because inakupatia hiyo worry. What are they going to think about me, you know?
Mhm.
Or they're going to judge me. You become so self-conscious. Nimevaaje? Hii kiatu nimebrush vizuri, you know? Like unakuwa so much self-conscious, it becomes a problem because you won't be able to stay comfortable within that social setup or social situation.
Okay, so let's join this anxiety. How can we deal with anxiety? I think we mentioned one about Jesus encouraging us Christians how to deal with anxiety. That's a spiritual way of dealing with anxiety, right? What about this other social?
No, we didn't level up the spiritual way. And let me tell you one thing: everything that is spiritual is more real than anything that is physical.
Physical.
Now, for us, because we are believers, there are ways that you are supposed to handle anxiety with, or rather using. For example, we've been encouraged. We are encouraged from the word of the scriptures, which carries the breath of God, becomes a source of encouragement to us, even when we feel like we are terrified, even when we feel like we are losing it. We will find comfort in the scriptures. And another thing is prayer. You find before you realize, before you get into that room where you are going to be interviewed, you are encouraged to pray about everything, and with thanksgiving let your needs be known to God. Now Jesus is encouraging also the disciples, come to me, all of you who are heavily laden. So when you take it to Jesus, then you live a stress-free life. Yeah, you take it to Jesus. That's the solution number one. Take it to Jesus. Give him the worries. Give him the fear. You see? Give him the terrifying situations. Give him that. Then you let him handle
Yes,
it for you.
that's right, yeah. And
Yes.
another way.
Now, generally, we have two major ways that we can use to help people deal with anxiety, and it's similar to the way that we deal with also stress. Number one, we deal with lightening the load. We deal with lightening the load, and we also deal with empowering the person. Now, with empowering the person, we have something like let them live healthy lives. Let them do exercises. Let them eat healthy. Let them sleep well. Last time we talked about sleeping,
Sleeping.
and so many people ignore these three things: sleeping, eating healthy, and exercise.
And fasting.
Yeah, actually, fasting is a
Yes,
very good way
fasting,
because
yes.
ina cleanse mwili by its own.
Yeah, inatoa toxic.
Inatoa toxics. Yes. So it's also a good way. People need to watch these three things so very keenly. Eating healthy, and eating healthy is eating a balanced diet. See, like eat a balanced diet all the way from morning, noon time, in the evening,
Drinking a lot of water.
drinking a lot of water.
Yes.
Yes, drinking a lot of water. And at times with anxiety inafikaga point mpaka mtu anakuwa anaumwa na kichwa. But when you find yourself in that situation, don't be fast kwende madawa unless you consult a medical professional and anakwambia you can actually go for medications, but actually just drink water and drink water in plenty because
It
itakusaidia
helps.
itakusaidia kurudisha nini chini.
Yeah.
But also one other way that so many people don't like taking is actually going for therapy, because with a therapist they will actually help you on a step by step way of you overcoming that thing that causes you anxiety. We have therapies that help people deal with anxiety. You know, we, for example, someone who is afraid of heights, unaweza ukatumia njia ya like you flood them, unampeleka to a high place, unampeleka to a high place instantly, and then unamwacha hapo, but you assure them that they are safe. So many people don't agree with
Yeah,
this
you should.
method.
So they will have this panic
They might,
attacks.
but it might work at the end of the day.
But-
It is
but
proven to work.
That's
that is not
risky.
that is
It's
not
dangerous.
safe, because
It is.
you are making that situation to be
Yeah,
more
worsening.
worsen. It is that is an extreme way. No, you cannot be serious.
Now, no,
You cannot take someone who is phobic of has a phobia for heights to
You can.
For high
no,
place.
no, 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 no.
now
no,
the reason why I said you go to a
no, 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 no.
therapist.
I
listen,
disagree with you.
Listen, hold on.
Huh?
The therapist will assess you.
You see, but
will
I
see-
believe,
he
I
will
believe,
see
I
if you're
believe there
ready.
are stages.
Yeah, there are.
There are levels.
There are levels, and I was going to that, but you okay, you cut me.
No,
I
no,
was
no,
going
no.
to that. You can use
Let him
that.
You have
finish,
even
let him
shocked.
finish.
You can
She
use
was
that,
shocked.
or you can go step by step.
Yes.
For example, someone who is afraid of being in a social place, autampeleka tu to a social place because they will be very uncomfortable. You know what you can start with? Mwambie akae in front of a mirror. And that which he would want to say in that crowd, let him say before a mirror. Like aongeleshe kio. After amemalizana na mirror, let him look for two friends. Aende aongeleshe hao friends wawili, that which he wanted to say in that social occasion. After amemalizana na hao friends wawili, don't take him straight to that, like that crowded room. Mtafutie wase 10, 15. Let him speak to them, like step by step. It's not all the time tutatumia flooding.
Now, what about in situations where we cannot go step by step? For example, there is an expectant mother, and the husband is outside the ward doors, or there is a person who is in the surgery rooms,
Mhm.
and there are some the relatives or the family members are outside waiting for their beloved one to come out of the surgery room. How can you deal with that?
Well,
How can you deal with maybe instances of things like things that are going to bring positive results, which you do not, which possibly will not provide the room for step by step?
now I'm going to go back to our definition about anxiety. And anxiety is that consistent worry that someone has because of something that is about to happen. You just have to give them that assurance yenye itamfanya aache kukuwa worried, and that's it. Like you'd be done.
And so you just talk to them, encourage
Just talk
them.
to them, assure them of that situation. Now most people fail at this because utakuja mwambie kila kitu itakuwa poa, like no, don't give them something that wewe mwenyewe you're not sure of. That mother might go into labor, and I'm not saying that it happens, but mtoi akifa na ulimwambia kila kitu itakuwa poa. So you need to prepare them. Hata kwa ile situation here, they're expecting positive news, but you have also to prepare them. What if
Something
news
happens.
itakuja the other way?
Yeah, for me, I think the simplest way, because there are times that we cannot afford to see therapists. There are times we cannot afford to find people who are expertise in such scenarios.
psychologist like
Yes,
him.
like my friend here. For me, I think the best way and the simplest way is to familiarize the people with the situations at hand. They have to believe they are not the first one, and they will not be the last.
Last one, yeah.
And then you expose them to the truth that it is just a season that is going to be off,
Yeah.
and you provide a way of how they, according to the situation at hand, you provide a way of how they are going to cope up with that. If they are afraid of talking to mass, you expose them to of effective ways of talking to
Mm,
large
people, yeah.
crowds of people. If they are afraid of heights, like my friend has said,
Mm-hmm.
you show them the reality about heights, the
Mhm.
safetyness of heights.
Heights, yeah. It's
Yeah, you introduce them to, you familiarize them with
you
the,
expose them.
yeah, you expose them to the factors, and you show them how
Yeah, yeah.
to handle.
Yeah,
easily.
thank you, thank you. So
And,
let's talk
one more thing.
schizophrenia now.
Okay.
Schizophrenia.
But it seems he had a way. He wanted to hit me. The way I saw him.
Time won't allow us. Yeah,
Because
so
of
for the
time.
sake of time, let's talk schizophrenia. What is this condition?
Now, a lot of people don't or have actually not heard of the word schizophrenia, but they've probably seen someone suffering from schizophrenia. And schizophrenia is just a disorder that affects the way a person thinks, affects the way a person feels, and will affect the way a person behaves. It affects these three factors in someone.
Have you heard about it?
Yeah, I've heard about it, and also I've encountered with a person suffering from the same disorder. And for me, it's to some people it is genetic. It is that point where, let me put in a way that it's a bit easy. Ni ile state yenye mtu anakaa ni kama amechizi. So hiyo kuchizi, kuna ingine yenye it is genetic. You see, you inherit some unbalanced brain chemicals reactions, or rather maybe uncontrolled behaviors, thinking behaviors, where the brain is not functioning like normally.
Yeah, it's not normal.
Yeah, people are responding to their way of thinking is a bit abnormal.
Yeah.
Yes.
You expect them to respond in such a way, but they are responding
Contrary.
contrarily to that.
Mm.
It is because their mind is, their thinking and their ability to comprehend things is unstable
Yes.
or direct opposite.
Mhm.
Yeah.
Yes.
So,
It's
science.
actually yes, it's true, but most times this happens because of that chemical imbalance in the brain. And I think we talked about it earlier when we said that our bodies, the way our bodies operate, it is operated by the brain, and the brain uses chemicals to send signals to every part of the brain. Now, when there's that imbalance, ndo kunakuwa na vitu zenye they won't be going okay. Utasikia wengine watasema huyu ni kama kuna waya iliachilia, you know. It's probably because they don't really understand what is happening to this person. And one factor or one thing about schizophrenia, once someone is suffering from it, they can be helped. They can find help. It is a disorder that can be managed.
Okay, before we get
But-
there,
Uh-huh.
you know, you have described it as someone, umetumia term insane, mtu mwenda wazimu. So how can you distinguish, differentiate aje that this one is not madness, this one is schizophrenia now? This
Wazimu haogi.
But pia someone with schizophrenia, hygiene inakuwaga mbaya. So
But
you can't really say-
unajua madness, it is, I don't know about madness.
let's
I
talk
think it's the
schizophrenia
extremeness
then.
of schizophrenia, but when mwenda wazimu totally haogi.
Mhm.
But this person maybe at times anadefer kuoga na reject kuoga.
Mhm.
Yani, okay, they are not that insane, but they are acting weirdly, differently, you know. You'll notice that this person is suffering maybe the way anavaa, wengine wanakaa very untidy.
Mhm.
Even though wanaweza kuzingatia some levels ya usafi, lakini wengine wanakuwa untidy. Unaona?
Now, just to add on to what you've said and disagree a little bit, that madness, yenye tunaita wenda wazimu, that's now schizophrenia in its worst case scenario. Someone who has not adhered to any medical conditions, someone who, in most times, schizophrenia normally develops in between ages ya young, wakati mtu ako in that teenage, hapo ndo onset iko. And mtu young, they can still go on with life in as much as inakuja ikimuaffect mara moja moja. You'll see this person hayuko fiti leo kesho, you know. But someone who's advanced in age and who doesn't take any medications, who doesn't have a family that can take care of them, we ndo tutasema ni mad, because you'll find them in the streets walking around with papers. But it's still that condition. It's still that schizophrenia.
Let's
For
talk
me,
about
I think
the symptoms,
ile
like
tuiweke rahisi,
hallucination. Let's discuss
ile
this.
tuiweke rahisi.
Yes.
A person with schizophrenia
Mhm.
ni mtu mwenye ameruka kichwa, si mwenda wazimu. ameruka kichwa imeruka.
What's
Sijui
the
kama una
difference?
get. Mwenda wazimu yani ni ule imeenda kabisa.
Lakini
It is
imeruka
cannot
kidogo.
be repaired. Unaona mtu mwenye ako na schizophrenia ni ule mtu unamwambia wewe kichwa yako imeruka, lakini anakuambia mimi sijaruka kichwa. Ana understand some normality,
Yeah, they do.
lakini hawezi kuact normal. Ana understand some, lakini mwenda wazimu ajui kama ni mwenda wazimu ama ako
Ama
normal.
ako sawa.
Yeah, ako dunia yake. In fact ako mwenda wazimu hawezi kaa na watu.
Yeah.
But huyu mtu mwenye ako na schizophrenia anaweza kuwa tu ako home, lakini unaona anafanya vituko hii funny
Yes,
funny.
yes, yes. So let's discuss this possible signs like hallucinations.
With schizophrenia, it has a number of signs and symptoms. But these signs and symptoms, they don't happen to everyone.
Yes.
Schizophrenia affects people differently. And they on different levels of intensity. You'll find the people having hallucinations. Huyu mtu anaona vitu zenye mimi nawe hapa hatuoni. Inaweza kuwa yeye anaona kuna mtu amekaa hapa, and for us clearly tunaona ni meza iko hapa. At times they have delusions.
Exactly.
Like this person would believe, mimi nilipatana na president jana, and you cannot deny them that like that is the Bible truth. That is what he
That
did.
is what he
Yes,
they'll
so they
believe.
have delusions. They would have delusions of kuna watu wenye wananifuata, and atatoroka kabisa. You'll see this person running away. They have delusions. At times you'd find that their hygiene levels kidogo itapungua. And when this disorder is beginning or ikianza, you'll find this person apo emotions zake hazitakuwa in check. This person either zitakuwa zina swing, zitakuwa zina range, and at times utapata like ako tu ana emotions, face yake iko tu, their emotions become numb. Those are just some of the signs that you would observe in someone with schizophrenia.
But I think the most ataikaje sasa like ndio ujue kabisa huyu mtu ako na this condition, tulisema in affect the way we think, right, the way we perceive things.
Yeah.
So it is very difficult for this person to differentiate something that is real and something that is imagined, right?
For them, it's like they're in their own reality. They don't live in the reality that we are in. In as much as kuna vitu utaona, okay, anafanya vitu, anakula, so they're there. But kuna vitu zenye yeye atakuwa naamini ama anaona that for us haziko. So they're in their own world or their own reality.
Again, some tend to believe that all of us are wrong. They are right.
They're the one that-
Hao wako sawa.
Wako sawa.
You the rest of the people,
Mtu ako na shida.
they are the ones who are having a problem. But them, they are okay. They are straightforward. You are seeing faults in them, but
For them, they're okay.
you are the one who is having a problem. They are okay.
Let's talk medication. Is there medication for this condition?
Now, this condition, let's begin by saying it has no cure. Si disease yenye utatreat na ishe. So someone has to be treated. It is a disease that is managed over a lifetime. This person would be given some medications just to treat the symptoms that are presenting. And the importance of this treatment, itafanya these symptoms zita suppress na at times hazitarudi. That's why at times you'd find someone suffer from schizophrenia, but they're very productive people even in the society. So just because someone has schizophrenia won't mean that haizi akafanya kazi, they can't be productive people.
Yeah.
They can be, but only if they adhere to the medications that they're given, and they also go for psychotherapy because they need to be counseled. They need to be like brought back to reality as it is.
Yeah.
Yeah,
Oh,
and
thank
to,
you.
and to some people, the signs and symptoms, to some people they vary. It varies to some with people. There are some who this time they are okay, another time
They're not.
why ameruka.
It's triggered actually.
Yes.
Yeah.
So what we can do, maybe we can we can control their behaviors. Maybe if they are working, they can be given some time off,
Yeah.
and then they go and have some rest
Mhm.
and deal with some issues. Akili rudi chini.
Watu relax.
Yeah, relax.
Mhm.
And to some, you focus on the time when wanna knock, then you have them under control.
Yeah.
Yes.
And one very important thing is the fact that at times drug and substances really cause this chemical imbalance. I'm sure you guys mmesikia of watu wanasema uni bangi alivuta kichwa ikaruka, but it's because ili cause your chemical imbalance in the brain and ikafanya. So if anything, people should really avoid drug and substance abuse.
Okay, thank you so much, guys, for making time to this show. Our listener, thank you so much for your time also as well, and always keep it youth power. See you guys next week, same day, same time, and same place. Thank you.